When the stimulation is applied, the current not only passes deep in the tissue, but also flows along the skin surface. The current reaching the recording electrodes gives the stimulation artifact. Since current travels at the speed of light, the stimulus artifact coincides with the time of stimulation. The stimulus artifact can interfere with the electrophysiologic signal and its measurements. Hence, it is of interest to minimize it. When the recording site is away from the stimulation point, less current will reach the recording electrode. Hence, the artifact is often much less for proximal stimulation sites compared to the distal stimulation sites in nerve conduction studies. The artifact will be more when stimulus intensity is higher. Hence, the best strategy is to minimize the stimulus intensity without affecting the response. This is done in two ways. First, the impedance at the stimulation site should be reduced. Clean the skin surface at stimulation site to remove oils, lotions, perfumes, etc. that are poor conductors of electricity. Many laboratories use alcohol-soaked gauze for cleaning purposes. Mild abrasives may also be used. Use them gently so as not to cause discomfort to the patient. Electrolytic gel should be applied over the stimulator pins to further improve the contact between the stimulator and the skin surface. The second strategy is to better locate the stimulation site. We identify the stimulation site using the anatomic landmarks and measurements. The stimulus intensity is gradually increased till a small response is observed. With the intensity maintained at that level, we change the position of the stimulator, medial versus lateral or anterior versus posterior, to locate the site that gives the largest response. Thus, we bring the stimulator to a location that is very close to the nerve. Then we increase the intensity to get the maximum response. By reducing the intensity for maximal response, we can have much less stimulus artifact. Here is a sensory nerve action potential recording from the medial antebrachial cutaneous nerve without optimizing the stimulator position. Due to high stimulus intensity, we also have motor artifact. With optimization, the stimulus intensity is much lower, 13 milliamps compared to 28 milliamps, and the quality of the response is also much better. The artifact will be higher if the current has low resistance along the skin surface. This will occur when the patient sweats during the electrodiagnostic procedures. This is a natural sympathetic response. The wet skin has low resistance. When sweating is seen, it is a good practice to dry the skin using gauze or tissue. The stimulator cables also act as antenna and give electromagnetic radiation. Hence, they should be kept away from the recording electrode leads. Overlap between these cables often gives significant stimulus artifact. A large ground electrode placed between the stimulation and recording sites may be more efficient in reducing the stimulation artifact. The stimulus artifact is usually reduced using a technique called rotating the anode. The stimulus current enters the skin from one pin and exits through the other. Thus, it can be modeled as a current dipole. The electrical field generated by such a dipole is shown schematically using isopotential lines. The potential decreases with distance from the dipole. In this example, the active and reference electrodes lie on different interpotential lines. They record a different voltage and generate a differential signal. In this example, the voltage difference is 1 millivolt, This will be amplified by the differential amplifier and seen as stimulation artifact. To reduce the artifact, one maintains the position of cathode over the nerve. The position of anode is changed to get the E1 and E2 to lie on isopotential lines with similar voltage. Now the active and reference electrodes are recording the same potential, and it will be cancelled by the differential amplifier. In this recording, the lateral antebrachial cutaneous nerve was stimulated using 3 different positions of the anode. In position A1, the artifact is going upwards. In position A3, the artifact is in the opposite direction. At a site in between, A2, the artifact is much less and the sensory response is least contaminated by the artifact. The stimulus artifact can be manipulated using the shape of the stimulation pulse. Here is a recording with normal polarity of the stimulation pulse. Note the artifact is moving to the top right corner. If we reverse the stimulus polarity, the artifact also changes its direction, and now it goes to the bottom right corner. In biphasic stimulation, the normal stimulus pulse is followed by another one of opposite polarity. The first stimulus causes nerve stimulation and yields the sensory nerve action potential. During the second pulse, the nerve is refractory and does not produce any response. However, the second pulse produces an artifact that is opposite to that of first stimulus. Hence, the slow artifacts from the 2 stimuli are cancelled and we are able to record a response with a good baseline. The biphasic stimulation doubles the duration of stimulus pulse. Hence, it may not be effective when the distance between stimulating and recording sites is very short. The overall stimulus intensity change is also twice that of a monophasic pulse. This can also make the stimulation more uncomfortable. Some systems offer digital signal processing algorithms to reduce the stimulus artifact. Here is a sensory nerve action potential recorded with the stimulation of medial antebrachial cutaneous nerve of the forearm. The distance between the stimulation and recording sites is only 10 centimeters, and hence we have a large stimulus artifact. Despite the artifact, we can easily recognize the sensory response. It has a very short duration and it changes direction rapidly. In contrast, the stimulus artifact is a slowly changing signal with U shape. These differences in signal characteristics are analyzed by a digital signal processing algorithm to identify the artifact and remove it. Here is an example of such analysis. We have the sensory potential with stimulus artifact. The artifact is estimated by the algorithm and then subtracted from the signal. The resulting waveform is thus digitally enhanced. It has a very satisfactory signal with good baseline before and after the sensory potential. Also note that the artifact removed by the algorithm does match its visual assessment. It does not show any significant portion of the sensory response. In other words, the signal enhancer has managed to preserve the sensory response and remove only the artifact. Hence, I feel confident in using digital enhancement when other methods such as biphasic stimulation or anode rotation are uncomfortable for the patient.